Good afternoon, everyone, and welcome to the Margin Live talk on our BSc On's Health and Wellbeing Practitioner course. My name's Kari, and I am one of the student recruitment team here at Margin. My job today is looking after the question and answer box. So please, if you do have any questions as we go through, please drop them in, and we will get to them when we kind of after the talk. As this is a new course, we don't currently have any students on it, but what we do have is we've got two current students. One, Laura, who is a first year strength and conditioning student, and Kelly, who is a master's student in sport rehab, but she also did her undergraduate with us. And she's done a lot within the clinics that Joe will come and talk to you about in a minute. And I would like now to introduce you to Joe Layden, who is the program leader for this course, and he is going to take you through the course in all its detail, and then at the end we'll have questions, so please do drop them in as they come to you. Thank you, Joe.
Hello everybody. Yeah, my name's Joe Layden. I'm the program leader for the Health and Wellbeing degree, so I've got a bit of a presentation here to go through. Apologies if this is a little bit sort of distant, because it's not really what I'm that used to. I like normally in front of people talking, and I find this a little bit strange, but we're getting used to it. It's a brave new world that we're in, so please bear with me. Well, anyway, what I kind of want to cover today, sort of this next sort of 15 minutes or so, is just a bit of an overview of the, and a background to the Health and Wellbeing program. I talk about background because Carrie said that the Health and Wellbeing degree is new, but actually there is about 10 years of background to it, so I want to get that message across. I'd like to talk about what the degree is about and kind of what you can really expect from it, because I'm pretty sure that everybody's had a look at the prospectus and you've had a read at that, but in terms of your interpretation of it, it may not be quite the same as my interpretation of it. So I kind of want to give you what I think the program is about, and if that doesn't fit your idea, you can ask questions at the end, and then I've got an opportunity for you to ask questions, because I think that's really important. And I've just put down here, you can see a picture of, this is me and Oscar, my cat. And Oscar, the reason I put him up there is he looks pretty ferocious, but he's not really. And the same, I might look a bit ferocious, but I'm not. So please do ask questions. Please feel free to ask questions, because Oscar's out the back, and he can help me out. So what I'd like to do, I'm going to just kind of put the program into a bit of context, and if we think about, what are the top 5 global risks for dying, or mortality. And mortality is your opportunity to meet this fella here, and really the top 5 causes or the risks are high blood pressure, is 13% highest, smoking, high blood glucose, physical inactivity, and overweight and obesity. So these are the 5 biggest risks to cause death, across the world. This is from the World Health Organization, as data that was produced in 2009. It's pretty old data, but things have not changed that much. Now, when we look at that if we take the high blood pressure, high blood glucose, what's the biggest cause of death is cardiovascular disease, and 32% of the world's death globally are caused by cardiovascular disease. Now, if we have a look at that here, we've got the factors that contribute to cardiovascular disease are age, education, income, activity, diet, how heavy we are, alcohol, smoking, diabetes, all of these different things. And if you think about them, every single one of those is modifiable. We can change them, we can alter, essentially our risk of dying, and we can reduce factors that cause cardiovascular disease. So we are kind of in this situation that, there are so many factors that influence health and well-being. So if I kind of talk about the background and the rationale. So Carrie mentioned that it's a new program, but about 10 years ago, we set up a program at Marjon called Health, Exercise and Physical Activity. And we were aware of the fact that, if I come back to this one, that factors such as physical activity, your nutritional intake, alcohol, smoking, and all of these factors could influence people's health. So we set up Health, Exercise and Physical Activity program. That was very successful, but over the past 6-7 years, we have learned ourselves that, just trying to get people to exercise, and prescribe exercise to people who've got health conditions is not adequate. We need to sort of look at changing people's behaviours, and sort of, helping people take responsibility for their own health and well-being. Now, we've been shouting about this. I said we had the first program sort of 10 years ago, similar sort of message, but it has evolved. But finally, the NHS and the British government are finally catching up with the message that we have been putting out for about 10 years. There was a document, Next Steps for the 5-year forward plan, which essentially has the NHS has said, recognise that they don't have the skill or the organisation to look at health and well-being. Typically, health and well-being within the NHS is approached by, if you have an illness, come and see you and we will try and fix it. What we have been advocating now is, how's about you try and prevent yourself having an illness and you won't need to go to the National Health Service. And with the new documents, Facing the Facts, Shaping the Future document, the NHS essentially have thought, we need to change our approach. Now, as part of, I talked about the evolution of the Health and Wellbeing Programme, we've had numerous conversations over the past 2 or 3 years with the likes of Matt Gibbons, who's a primary healthcare manager at Cornwall Health. We've spoken with Health Education England, numerous partners in terms of what staff do you need for this new change. So it's essentially they've acknowledged this, the healthcare is undergoing a significant and rapid transformation. And they say a significant partners are required, and the patients need to change themselves. Engaging and educating patients whilst developing and supporting their self-efficacy will be the key to success of this change. There's a recognition that the skills needed to effect the change are lacking, and there's now the need to look further in fostering and developing a new workforce, which is the degree programme that Health and Wellbeing is now. So it's an evolution of what we had before in terms of trying to get people active, trying to get them moving, but we've developed this new programme where we have negotiated and spoken with the NHS in terms of what do they need, what do they require. And to kind of put it into context, here's a map of Plymouth. I'm not sure if the people folk who have logged in, whether you're from Plymouth or whatever, but if we look here, there's the average life expectancy in a place called Stonehouse in Plymouth is 75 years. If we go across just a couple of miles to the other side of the city, you live in Chadlewood, it's 86.5 years. So you're looking at an 11-year difference in life expectancy just across 2 miles in the city. So if we're talking about health and well-being, why is there a 10 or 11-year difference in life expectancy? So one of the things we start to look at, so we've got the individual, we've got interpersonal things. So who do people socialize with? What do they do? What are their activities? What's the organization? What environment do they live in? What are their beliefs? What's their nutritional habits? Community, culture. What's the policy around supporting individuals? So there's a lot of factors that contribute to that 10, 11-year difference in life expectancy, people being able to take responsibility for their own health and well-being. So understanding that is fundamental. Now, this is a complicated diagram. You don't have to understand it all, but it's kind of a picture that's looking at all the factors that influence health. So up here, you've got individual psychology, social components, food physiology, activity, the environment. And then you've got down here, they've got media, social, psychological, economic, activity levels. So this takes us to BSc Health and Wellbeing Practitioner. So what we've got now, we've got a 3-year program, typically 18 modules over the 3 years. And we tried to make sure that it's as varied as possible. But when you look down through our list of the first year modules, we've got what is the health and wellbeing professional? So that's an intensive module and looking at what do we do? Then we've got the modules on anatomy, physiology, sociology, psychology, all of those factors that kind of fit into that model. As we develop into the second year, we're now looking at nutrition. How do we promote health? How do we change people's behavior? And then, so these kind of, that level of knowledge and depth and understanding of that entire approach to our health and well-being is developed across the 3 years. So that really complex model that you just seen, don't panic, you don't need to understand that now. With any luck, you might understand it at the end, but that's a work in progress. So, but anyway, and also as we go throughout the program, you will see that there are exercise for health modules, exercise prescription and fitness professional, and then advanced lifestyle practitioner. So we've got a lot of practical based modules in there where we engage with sort of the physical activity, the different components. So I'm not going to spend too long on this bit here because for me, I think it's about you guys getting to know the context. If you've got any specific questions on any of the modules, please get in touch and I can talk you through the content of them. So overall, what is the content that we kind of address? And it's physiology, psychology, sociology, biology, nutrition, the interpersonal skills. How do you interact with individuals? You know, if you're working with a client who is morbidly obese, how do you speak to them and say, you need to lose a little bit of weight, you need to get active? So just saying, hey, fatty, is not going to work. But, you know, there are approaches and, you know, how do we solve problems? If individuals have, you know, if you're working with a community where, you know, the culture is to eat fast food, people don't like to exercise, how do you change that community? How do you change the behavior of that entire, you know, how can we solve, what are the problems that we need to look at? Where's the evidence that allows us to do what we do? So these are sort of some of the skills that you will learn as you know, as part of being on the health and wellbeing program. We've got our lab-based environment, classroom-based environment, and hopefully get into the graduation. Now, this somebody post COVID-19, there's a big concern. I know a lot of you will have concern at the moment in terms of, you know, what's life going to be like at university. I'm not really here to answer that question at the moment. I think there are some talks later on. People are much more informed about that than myself. But I wanted to just kind of introduce you to Ben Jane. Ben is one of our senior lecturers. He's got a background in physical activity, public health, and he's got just a 2-minute chat on what our approach to teaching might look like, or what it is like at the moment.
Joe, I'm just having some sound issues with that one.
Are you?
Yeah.
Let's see if I come out of there. Oh. Is that the right screen again, Carrie?
Yeah.
Again.
Hello, my name is Ben Jane.
Any better?
Yeah, loads better.
Bye, Ben. Enough, Ben. Okay, so I hope that gives you a bit of a flavour as kind of some of the approach that we've been making towards making sure that we are, in a position to deliver online. It has been, fundamentally part of our programme anyway. So in addition to sort of the academic skills that that you will develop as part of the programme, one of the things that we really have focused on the degree, it's about employability. We want to make sure that there are jobs that people can go into or that people are employable when they leave. As you can see, we've got a large number of partners that we work with. And these have all informed, as I said, the content of our programme. And as I said, throughout, we have got embedded professional qualifications. So for example, I mentioned some of the physical activity ones. What we're looking to have is by the end of the third year, students will be completing a REPS level 4 qualification. And level 4 is an advanced exercise professional. There are not that many level 4 qualified instructors in the country. In fact, I had a call from Derriford Hospital just about 3 months ago saying there are no level 4 cardiac rehab specialists in the southwest. Do you have any? And I said, not yet, but give me a few years and we'll have some of the best. So we do have a big focus on the professional qualifications and the professional aspect. As part of that, we have a series of clinics that we run at Marjon itself, and fundamentally these, in my mind, are about student engagement. So we've got the back clinic, leg cancer clinics, health clinics, active choices, a lot of different bits and pieces going on. Typically, I like to see our first years get involved with the clinics, second years help deliver them, and third years typically run projects, sort of investigating the clinics. And some of those projects can be quite simple. I had a student who measured, we give people pedometers to look at their activity levels. And one student said, well, Fitbits are much better than pedometers. Pedometers cost £10, Fitbit cost £200. So we bought 10 Fitbits, 10 pedometers, and we compared how they motivated individuals to exercise. Turns out £10 pedometer is just as good as a £200 Fitbit. So there's lots of projects and things that people can get involved with, but it's all about professionalism. And to give you an idea, if you want a bit more information on the clinics, I've got a link that's in here, which will take you to them. And we've got a dedicated website. If you go on to info for patients in here, it shows you the different clinics that we've got. So we've got the back gym clinic, and there's a lot of information in terms of what do we do, who's it for. It gives you some background. We've got the health and wellbeing MOT checks. So we get individuals that come in, we'll look at cholesterol, glucose, heart rate, various different pieces. This is our lab. You guys have spent a lot of time in this physiology lab. So that's a great opportunity for everybody to get involved with throughout the clinics. We do have, I'm sorry, Karen, I'm not sure how I'm doing for time, but I wanted to kind of also introduce you quickly to John Downey. He's another one of our staff. John's got a background in behavioural approaches. I'll just let him talk. Right, so I'm going to stop John there. I asked him to do a short talk, but he managed to keep going. So I'm going to have to stop him. I think I can post the link to John's talk, and I think you should be able to see it within the chat. So if I can send that link out later on, Carrie, maybe you can post that up. But just one of the things that John mentioned is he said that Marjon has been a champion of this approach to healthcare for quite some time. And just along the bottom here, you can see person-centered physical activity for patients with low back pain, pilot and servicing delivery. This is a research publication that we released a couple of years ago. Saul Bloxham, who's the head of school, and there's myself at the end, Ben Jane, who you saw earlier. And then there's another one here, longitudinal effects of physical activity programs. Again, with Saul, myself and Ben. So at Marjon, the staff that deliver on this health and wellbeing program are experts in the field, and we are really leading this area. So if you come along here, you'll be in good hands. Just in terms of opportunity, because I know that there are issues in terms of your availability as a student coming along. You're not sure, and we know you have to work, you've got other things going on, but this is just a typical calendar from our clinics that have been delivered. So you can see there's something on pretty much every day. So if you want to get involved with the clinics, outside of studies, there's always opportunities as well. So that is always there. I just wanted to kind of put this up, just as these are some of the testimonials of. We run a program called Long-Term Conditions. And it's for individuals who have been diagnosed with a long-term condition. So it could be cardiovascular disease, diabetes, COPD, something like that. And we've delivered our model, and we've had our students help contribute to this. When you get this sort of comment and feedback, it really tells you that the individuals and the students in our program have the potential to make a big impact upon people's lives. And that's kind of what we're looking for, is individuals like yourselves to come on and study this health and wellbeing. But it's not just about us saying it. There was a review undertaken quite recently by the Physiological Society, and they looked at patient benefits from student-led activities. And essentially it was a review that how the activities that we engage with our students and how they deliver the programs have a big impact upon society. The Health Education Guild for England, or the Higher Education Guild for England, have recognised that as a really quality way of teaching. And EMSI is an organisation that looks at employability and said that the teaching approach that we've been adopting within this model is highly effective with developing professional skills. So this has also been, I wanted to just quickly mention CIMSPA. CIMSPA is the Chartered Institute of Management of Sport Physical Activity. They have been working with us. We've worked with them quite closely. We've now got a professional recognition for professional standards for long-term conditions and for Health Navigator. We are currently working with CIMSPA to get the title Health and Wellbeing Practitioner as a chartered title. So hopefully in 3 years' time, when you guys are graduating, there will be a Health and Wellbeing Chartered Practitioner title out there. So over the past few years, the NHS has had a shift. Professional organisations like CIMSPA have had a shift, and they've finally caught up with us. We're now ready. It's in a really high professional standard. It's delivered at a high caliber university. I don't know if you've seen any of these, in terms of, we're ranked #1 in England for teaching quality, #5 for courses, silver award for teaching. So I'm not going to stay there. I think we'll have to mention, I think later on there are some other talks that are taking place. There's a guided tour campus. Do log on to those, because there's a lot of information. I've just talked about my course, but actually being at Marjon, there's a lot more to it than just the program. So I think it's definitely worth logging in to have a listen to some of these chats. And I think I'm going to have to stop now because I'm way over time. But folks, I don't know if you've got any questions just now. I'm happy to take them and maybe answer some questions. Carrie.
Brill, thanks, Joe. Would you be able to let us know what kind of the assessments are going to be like on the course?
Yes. Do I need to stop sharing my screen or what do I do, Carrie?
No, leave it there. That's absolutely fine.
Yeah. The assessments are highly varied, and we try to make them as applied as possible. So, for example, one of the things that Ben mentioned there was we have an assessment where individuals will construct a website. We typically use that website across the 3 years. So individuals in the first year, we've got a module that looks at academic skills and professional skills, and individuals start to look at, what are my strengths, what are my weaknesses, what are my aims and ambitions, and where do I want to get to? So within that website, people will start developing, sort of a blog in terms of what they're interested in. And then in the second year, they would go on a placement to help develop those skills, but that will then add into the website as well. So that's a sort of a vein. We have practical assessments, depends on the type of modules. So if there's a module that's got an exercise prescription focus, there will be assessments within the gym, and the majority of the other assessments are coursework based, and that's either in the form of an essay, a laboratory report, or maybe a presentation. So yeah, it depends. They're highly varied.
Great, thank you. And Kelly, I'm going to come over to you now, if that's okay. And I know you've had quite a lot of experience within the clinics. Would you be able to talk to us a little bit about that experience, please?
Yeah, so I'm currently on a master's in sports rehab, and I've done the pitch side stuff with football and rugby teams, and I wanted a different kind of approach. So I have been taking part with the multiple different clinics for the last year. I've taken part in the cancer, mixed cancer group, prostate cancer, leg ulcers, back pain clinics, active choices, all of the ones that Joe said. And during them, we've just given some of them just the confidence to get back into training, get back to fitness, especially in the cancer ones, they might be in remission or need to lose some weight to be able to have the operation, that kind of thing. With some of the other ones, it's trying to keep them motivated to keep going. So the active choices, where they've come from many of these groups into this just to meet with someone every week to give them some support. The leg ulcer one is a one alongside Live Well Southwest, so you do get to work with Derriford Hospital, Macmillan, and the different ones that fund these things. So the leg ulcer clinics run all over the Southwest, so I've been to Kingsbridge and Marjon, as well as all over Plymouth, and they're just giving people who have lower limb leg ulcers, which are on the lower limb, exercises to try and help the circulation of their blood, keep moving, that kind of thing, as well. So there's a variety of different ones, all helping and contributing, and you meet different people of different ages, different backgrounds, and you could have a 4-6 week course with them, and you get to see a massive improvement in themselves, which is great thing to see.
Brilliant. And what's your favourite part about working in those clinics?
It's definitely seeing like the improvement and like how their mindset changes depending on the client. So I've had clients who have been amputees due to cancer, and they were petrified coming into the clinic, and just didn't want to take part. And then afterwards, because they were told to do all these different things, and then the relief, the happiness, everything that they had afterwards was, and taking part of just getting in and using, the hand cycling machine in the gym, or, just meeting other people who are similar. It's great to see a big difference in someone's day-to-day life.
Great, thanks, Kelly. And Laura, I'm going to come to you next. Would you be able to tell us a little bit about kind of your experience in coming to university? Because you're just coming to the end of your first year, aren't you?
So I've finished my level 3 BTEC in sport, and I was quite worried to initially come to uni because I thought the transition from the workload might be quite difficult. But I found it surprisingly, if you're organised, is very easy to keep on track of the work, keep on track of the social side. I think it's really easy at Marjon to make friends. They make it very the student ambassadors and stuff on either your first day, you make friends straight away. It's been a really easy and happy transition.
That's really good to hear. And kind of, what's the support like from the academics? Is it easy to go see them?
Yeah, and I see student support and the academic support, and it's really easy to get both. And you can get help on literally anything you need with the academic support, and they're all really like passionate about what they do, so they don't mind helping.
Yeah, definitely. I think Joe's definitely shown us the passionate side of it with the talk today. That's great. That's brilliant. Thank you. And do you take part in any sports clubs, Laura?
No, I don't. But I think I'm going to the following year.
Okay, excellent. Thank you. And Kelly, I know you've been involved in sports clubs. Would you be able to tell us a little bit about kind of what that brings to your university experience?
Yep. So during my time at university, I was in the swim and water polo team. They train mostly in the evening, so it can fit in with your studies quite well. And then most courses, not all of them, give you Wednesday off, and that's the day for sport within the university, which is great. You get to meet different people. You may be in first year, but you get to train and be with people who are in, you're in third year, let's say, or postgrad students. While being at university, I was able to be club captain for 2 of my years, which I wouldn't have been able to do at a bigger university, I don't think. Gave me so much more experience learning how to deal with the team, as well as solve more different problems within the team, hold AGMs, so many different things, treasurer and that kind of thing. So it gives you the opportunity to gain experience in multiple different areas, so from extracurricular activities to placements.
Great, thank you. And Joe, I'm going to come back to you just I think on one of the last questions, and it's kind of something you've touched on a little bit in terms of kind of the development of the course, but what is kind of the job going to look like at the end of this?
Well, the jobs, it's quite varied, I think, and it depends typically on where individuals' focus might want to be. Obviously it's going to be sort of in the area of potentially health and well-being. I talked about the change in the NHS and that sort of new direction. And if you look online now, there are already roles such as health navigator, social prescriber, those type of roles, but essentially are trying to work with people in communities and sort of send them in the right directions. I had a meeting with Health Education England and some NHS staff, and we talked about our potential graduates, and they said, "But your graduates will be probably too qualified for these roles." And I said, well, health navigator, social prescriber, starting at 23,000 a year, that's not a bad starting point. So there's that sort of role, but I think the role is developing as well. As I said, I had a conversation with some GP practices, and they've kind of talked about they have a lot of patients who they see regularly, who are not monitoring or managing the condition very well, and they're looking for individuals who can take responsibility for those people to prevent their poor health reoccurring. So that sort of role is going to be available. But then there's typical roles. So we've got within, if we just look across Plymouth, there are, diabetes-based programs, there are weight loss programs, there are individuals who, as part of the program, they get the level 4 reps qualification and they go on to be a highly specialized exercise instructor, setting up their own gyms. We've got there's a couple of previous graduates from the HEP program are running gyms in Plymouth. I know that they're very successful. So typically, I think as people go through the program, they kind of find their own area of interest. And for some that's the physiology. For some it's really the psychology or the sociology, and then that gives you opportunity in the second and third year to kind of, there may be a nutrition-based module, and some people will, within that module, the assessment can be quite open, and individuals get the chance to kind of tailor the assessment to their area of interest. So, they could write an essay on, the physiology of the nutrition, or how society might influence nutrition. So people can kind of develop their own area of expertise and go down that different route. So there's a lot of scope. There's not one prescribed job at the end, but I do think that over the next coming years, the roles available to health and wellbeing professionals or practitioners is only going to get greater.
Great, thank you, Joe. And that's all the questions we've got. I don't know if you wanted to say anything else at the end, Joe, at all?
I hadn't anything planned.
That's absolutely fine.
But I was just going to say, if anybody does want to get in touch, you know, and you know, just have a chat, or if they've got a question that, you know, maybe nervous asking online, you know, my email's there. You know, just drop me a quick email. We'll have a chat, and more than happy to do that.
Great, thank you very much. Thank you very much for joining us, everyone. As Joe said, if you do have any questions, please get in touch directly with him. And if you would like to find out more about any of the other sessions, just go on to the Margin webpage, and you'll be able to find out kind of about all the other Margin Live sessions, get a guided campus tour, and find out more about the campus. So thank you very much for listening.
Yeah, bye.